A common job that interns are asked to do is to give the first dose of an IV drug. This video describes how to ensure that you administer IV drugs safely. It is easy to make mistakes when given an IV drug, and this can have serious consequences for patients because the drug enters into the circulation. To ensure that we correctly administer IV drugs, we use the 7 rights of drug administration. These include right patient, right route, right drug, right dose, right solution, volume, rate. I will describe the application of the 7 rights of drug administration to the administration of 3 drugs, firstly amoxicillin, then clarithromycin, and then metronidazole. When you are asked to give the first dose of amoxicillin, go to the patient's notes and find out what is the clinical context of the administration, what is the reason to administer the drug. Look at the notes to see if there's any allergies recorded. Check that the drug is prescribed, and look through the other drugs the patient is on to make sure that there is no interactions. Go to the patient's bedside and perform positive patient identification. This involves looking at the patient's wristband and comparing the drug cardex against it to ensure that the name, date of birth, and the MRN correspond. Confirm with the patient the clinical picture and the reason for the drug. Ask their permission, and then ask them, have they ever received the drug before, and double check that they are not allergic to amoxicillin. Then in terms of the IV line, make sure that it's present and there is no evidence of phlebitis and that it can be used. Then take the drug cardex and go to the room where the drugs are kept. Find the IV drug administration guidelines and look up amoxicillin in it. Check to see how the drug is given or is reconstituted and administered. The IV drug administration guidelines tell you how to reconstitute and administer every drug. So in the case of clarithromycin, in the case of amoxicillin, 500 milligrams, you add 10 mils of water for injections to the ampule, and then it can be administered by an IV push slowly over 3 to 4 minutes. Then check with the second healthcare professional the route that we're giving the drug by the intravenous route, and that we are giving the correct drug and dose. In this case, amoxicillin, 500 milligrams, and this is amoxicillin, 500 milligrams. So you're checking the ampule against the drug cardex. Then go on and check all the solutions with the second healthcare professional again. So check the water for injections, which is going to be used to reconstitute and administer the drug, and check the 0.9% sodium chloride. Also mention to them how you intend to give the drug. So in the case of amoxicillin, 500 milligrams, you're going to reconstitute using 10 mils of water for injections and give it by a slow IV push over 3 to 4 minutes. Then proceed to draw up your normal saline. Occasionally, in some hospitals, you can find pre-filled syringes of sodium chloride. Then label your syringe and put it onto the tray. Then draw up your water for injections. Reconstitute the amoxicillin using the water for injections. So this involves holding the ampule upright like so, and then putting in the needle and injecting a couple of mils to start the powder going into solution. Then turn it upside down and holding the syringe to prevent air entering into the syringe. Push in a little bit more volume of solution, and then allow it to mix back and forth whilst not allowing any air to enter into the syringe. Once you've reconstituted your amoxicillin, label it and put it onto your tray. Then go to your patient and, using an alcohol wipe, scrub the hub of the extension set. Attach the syringe containing the 0.9% sodium chloride and open the tap mechanism. Inject 5 mils of 0.9% sodium chloride to flush through the extension set. Then you're going to give your amoxicillin, and as we said earlier on, we give it by an IV push slowly over 3 to 4 minutes. So connect your amoxicillin and give it slowly, give the 10 mils slowly over 3 to 4 minutes. It doesn't have to be as a constant flow. You can push in a little bit and see how your patient is. Ask the patient to tell you if they start feeling unwell at any stage. If they do start feeling unwell, immediately stop the injection of the amoxicillin, disconnect it, and get ready to treat the patient for anaphylaxis. Once you have injected the amoxicillin, which should take about 3 to 4 minutes, then you can inject the rest of your 0.9% sodium chloride, closing the tap mechanism before disconnecting, stopping blood coming back into the cannula. Okay, so that was amoxicillin. Now we're going to talk about the safe administration of clarithromycin. So similar to the amoxicillin, we obviously start with the patient, making sure that we've got the right patient, asking them have they ever had the drug before, and asking whether they have any allergies. Then bring the drug cardex to the room where the drugs are kept. Look up the IV drug administration guide to find out how the drug is administered, how the drug is reconstituted and administered. So in the case of clarithromycin, the important point here is that clarithromycin cannot be given as an IV push. It must be given by an IV infusion into one of the larger proximal veins over 60 minutes. We start by reconstituting it using 10 mils of water for injection, and then we add the reconstituted product to 250 mils of 0.9% sodium chloride or glucose. So start by checking the route and the drug and dose and all your solutions with a second healthcare professional. Check the way of administering it, in other words, in 250 mils of 0.9% sodium chloride over 60 minutes. Start by reconstituting your 0.9% sodium chloride, then label your syringes again, and then take the water for injections and reconstitute the clarithromycin using the water for injections. So push in the water for injections into the ampule and then drop the clarithromycin into the syringe. And then what we do is we open the bag, the 250 ml bag of 0.9% sodium chloride, and we inject the clarithromycin into the bag. Then we label the bag, with clarithromycin. This label here with the patient's name, the drug name, clarithromycin, the patient's medical record number, the amount that we've added into the bag, 500 milligrams, and the solution that has been added into 250 mils of 0.9% sodium chloride. We sign it and we put the date and we put the duration of the infusion as well. Then we put that sticker onto the bag. Then we're going to run through the solution in the bag through a giving set so that we can connect it up to the patient. So just to talk about the different parts of an giving set, this is the spike that goes into the bag. This is the drip chamber, and this is the roller clamp. So take it out of its bag and close the roller clamp to start with. So by closing the roller clamp, you'll stop any movement through the line, and that's what, or the giving set, should I say, and that's the way we want to start. Then we're going to take off the cover of the infusion bag, and we're going to put the spike into the infusion bag then. Okay, the roller clamp is still closed at this stage, and what we do is we squeeze the drip chamber to allow some solution to come from the bag into the drip chamber until it's about 1/3 to half full, as you can see, up to this level here. Then what we're going to do is we're going to gradually open the roller clamp and see the solution start come into the giving set. Do this slowly because we don't want any air to enter into the giving set line. We do this gradually, and you can see that the solution is going through the line here. When we get to this part, the part that goes into the pump, we need to make it upright so that it clears the air out of this part of the tubing effectively. Then eventually we'll get to the end of the line, and we can close the roller clamp then at that stage. Then we put it into the pump. We program the pump. In this case, we're going to give 250 mils of the solution over 1 hour. That's the way we're going to administer it. We're going to scrub the hub. We're going to flush through the extension set. Then we're going to connect our giving set to the extension set. And then we're going to start the infusion. Once this infusion has gone in, that will be after an hour, we're going to flush through the extension set again using the 0.9% sodium chloride. Okay, so our last drug now that we're going to talk about administering is metronidazole. So same way, again, we're going to check to see that we've got the right patient, that the clinical context is appropriate to the administration of metronidazole. We're going to check whether they've had metronidazole, also known as Flagyl, before, and we're going to ask them, we're going to confirm that they're not allergic to any medications. Then we're going to take the drug cardex and bring it to the room where the drugs are kept again, and we're going to check the IV drug administration guide as to how the drug is reconstituted and administered. So in the case of metronidazole, you can see that the drug is already in solution. Okay, so all we need to do is give it by an infusion over 20 minutes, and you'll see how we do that now. So we're going to check the metronidazole, the name of the drug, metronidazole, and the dose with the second healthcare professional. And we're going to check that we're giving it by the right route, by the intravenous route. Then we're going to run the metronidazole through a giving set. So first of all, we take off the foil cap here, and we close the roller clamp of our extension of our giving set. Then we push in the spike of the giving set into the metronidazole, and then we push some of the metronidazole into the drip chamber here, and then we gradually open the roller clamp to allow the metronidazole to flow through to the end of the giving set. Okay, then we connect the metronidazole to a pump, and we give it over 20 minutes as we indicated. So that means we're going to need to scrub the hub before we connect it, flush it through again, or flush through the extension set using the 0.9% sodium chloride, and then connect the metronidazole and start the pump. After we finish the infusion, we should flush it through again with 0.9% sodium chloride. So in summary, in order to give, I suppose, first of all, not all drugs are given the same. Not all drugs can be given by an IV push. So it is important to check the IV drug administration guidelines before administering any drug. Make sure that you comply with the 7 rights of drug administration: right patient, right route, right drug, right dose, right solution volume, and rate. Check all drugs and all solutions going into the IV line with the second healthcare professional. Thank you very much.